Namaskar dosto. Welcome to Vigyan with Dr. G. I am Dr. Govindarajan, radiologist and your scanning doctor. In my previous video, I spoke about ultrasound scanning in high-risk pregnancy and I covered first trimester scanning and also I covered elastography, cervical elastography. In this video, I'll be talking about ultrasound scanning in high-risk pregnancy, particularly in the second trimester. That means 12 to 28 weeks. ಅಂದರೆ 12ರಿಂದ 28ನೇ ವಾರದವರೆಗೆ 12 to 28 weeks. That is called the second trimester of pregnancy. ಈ ಪ್ರೆಗ್ನೆನ್ಸಿಯಲ್ಲಿ what are types of scans that we do using ultrasound? So once we have completed with NT-NB scan, now we know if there are any increased risk of chromosomal abnormalities to the baby or increased risk of hypertension in the mother, that is ರಕ್ತದೊತ್ತಡ ಜಾಸ್ತಿ ಆಗುವುದು, ಪ್ರಿಎಕ್ಲಾಂಪ್ಸಿಯಾ, ಅಥವಾ ಗ್ರೋತ್ ರಿಟಾರ್ಡೇಷನ್, ಮಗುವಿನ ಬೆಳವಣಿಗೆ ಕುಂಠಿತವಾಗುವುದು. ಸೊ ಇಸ್ ದರ್ ಎನಿ ರಿಸ್ಕ್, ಹೈಯರ್ ರಿಸ್ಕ್ ದ್ಯಾನ್ in the otherwise high risk pregnancy? So NT-NB scan tells us about all these things. I presume for our discussion that there is no such increased risk beyond the background risk of the patient. So that means that is called negative screening. So NT-NB scan is actually considered a screening test, and if it is not telling us that there is any increased risk beyond the background risk, that means it's a negative screening test. So in a case where there is a negative screening test after the NT-NB scan and of course some of the blood tests, what is the next scan that we do? 16 weeks, around 16 to 17 weeks, we do one anomaly scan which is called mid-trimester anomaly scan. Anomaly scan ಅಂದರೆ ಮಗುವಿನ ಅಂಗಾಂಗಗಳನ್ನು ಡೀಟೇಲ್ಡ್ ಆಗಿ ನೋಡುವುದು. I want to see the detailed picture of the baby's head to toe, including the brain, eyes, jaws, lip, nose, heart, abdomen, pelvis, limbs, upper limbs, lower limbs, fingers, feet. All these features will be identified. Additionally, I try to identify if there are any soft markers. So there are a few soft markers in the body which can again tell us if the baby is more prone for developing chromosomal abnormalities. They are some of the common soft markers, like for example choroid plexus cyst ಅಂತ ಹೇಳ್ತೀವಿ. choroid plexus ಇಲ್ಲ ನೀರಿನ ಗುಳ್ಳೆ, that is in the brain, or renal pelvic atelectasis, that means ಮಗುವಿನ ಕಿಡ್ನೀಸ್ ಅಲ್ಲಿ ಸ್ವಲ್ಪ ಬಲ್ಜ್ ಇರುತ್ತೆ. or there can be hyperechoic bowel, ಅಂದರೆ ಮಗುವಿನ intestines, small intestines of the baby, they look brighter on ultrasound. These are some of the soft markers. This is not the exhaustive list. ಇದು ಬಿಟ್ಟು ಸಾಕಷ್ಟು ಇರುತ್ತೆ, ಬಟ್ ಆದರೆ ಇದು ಕೆಲವು ಎಕ್ಸಾಂಪಲ್ಸ್. ಸೊ ಐ ಐಡೆಂಟಿಫೈ ಆಲ್ ದೀಸ್ ಥಿಂಗ್ಸ್. ಸೊ additionally I also identify the blood flow to the uterine, through the uterine artery to the uterus from the mother. So all these things, parameters keep continuing in the scans to go forward. Ultrasound of the heart, that is called fetal echocardiography, is a detailed scan which happens later in pregnancy, but at 16 weeks we will do basic fetal ultrasound of the heart. That is very, very important. After this, we also assess the growth of the baby in the same scan. So in the mid-trimester anomaly scan, it is a complete detailed scan of the baby, and additionally I'll assess the baby's growth. I'll try to find out if there are any soft markers in the baby. And again, if the soft markers are present, more than one soft marker is present, means we will have to do further testing to identify if the soft marker indication is actually correct or wrong. If there is only one soft marker, just a follow-up is sufficient. My next scan will be detailed anomaly scan. This is actually the 18 to 20 weeks. This is a standard scan in patients without high risk. Sorry. So 18 to 20 week scan, again I'm going to do the same protocol. I'll be doing brain to vertex to toes, brain, spine, heart, chest, and abdomen, pelvis, everything. There are again some of the soft markers. If I have identified in the previous scan, I keep on observing them. So again, 18 to 20 week scan is very, very important, because any congenital abnormality or any developmental abnormality in the baby, if I feel it is not going to allow the baby to survive after birth, then there is an indication for termination of pregnancy. Up to 20 weeks, termination is allowed. Beyond 20 weeks, it is a little complicated process. That is why 18 to 20 weeks is very, very important. Now at 22 weeks to 24 weeks, again we'll assess the fetal heart in detail. In this case, I'll be doing only the dedicated scanning of the fetal heart in different planes, fetal function, heart functions, pumping of the blood from the fetus heart, and the blood coming into the fetal heart, going out of the fetal heart to different parts, and also what is the velocity, if there are any shunts, that means holes between two compartments. We have got two right and left compartments of the heart. So if there is any abnormal communication, so these things we will be assessing. So this is called fetal echocardiography. Then again 28 weeks we'll do one more scan, which is called extended anomaly scan. This is again continuation of the anomaly scan. Again here we try to identify some of the anomalies which really become obvious later on in pregnancy. Like for example, I'm just giving an example, corpus callosal agenesis, which can appear clearly in by the end of 28 weeks. Or we can also appreciate some of the cardiac anomalies, say for example, coarctation of aorta, which can be better visualized at around 28 weeks of pregnancy. So these are some of the features that we identify in later on in pregnancy. Again, this is called extended anomaly scan. So if you look at anomaly scans now, 16 weeks I do a preliminary mid-trimester anomaly scan, 18 to 20 weeks detailed anomaly scan, 28 weeks extended anomaly scan, 22 to 24 weeks I do fetal echocardiography. These are all the basic scans in a high risk pregnancy. In between we keep performing growth scans and fetal well-being scans in between. Say for example, 16 weeks I do a fetal anomaly scan, mid-trimester anomaly scan. 18 weeks again I do 18 to 20 weeks I do anomaly scan. Here I don't have to do anything beyond this. In 2 weeks later I can do one fetal well-being scan, where I do fetal well-being, means fetal motilities and heart rate and fluid around the baby. And again I can go for 24 or 25 weeks I can go for a growth scan. Again, one more thing I want to stress upon is cervical elastography may be repeated at around 18 weeks again, if the condition is requiring an ultrasound scan. So those know, today I spoke about the timeline for fetal ultrasound in the second trimester in a patients with high risk pregnancy. In my next video, I'll be talking more about further investigation using ultrasound in the third trimester of high risk pregnancy. If you want to know more about ultrasound in high risk pregnancy, please follow me on Vigyan with Dr. G. Jai Hind.